Diabetes is an interesting disease that has struck the lives of many, but is now a manageable disease. Scientists have traced back to the Middle Ages and medieval times to when diabetes was first discovered. To this day, it is unknown who discovered diabetes, but they do know Egyptians were the first to know. A Greek physician named Ariatus was the first to study about diabetes. He attempted to treat the illness but could never find a cure. Back in the Middle Ages, people diagnosed with diabetes meant death sentence because it was untreatable. Diabetes is a shortened name for diabetes mellitus. Diabetes mellitus comes from the Greek word diabetes meaning siphon, to pass through, and the Latin word mellitus, which means honeyed or sweet. Around the 17th century, diabetes was known as pissing evil. Meanwhile, physician Thomas Willis determined whether his patients had diabetes or not by sampling their urine. If the urine had a sweet taste, they would diagnose them with diabetes. This became known as a sweet urine test and lasted until the 20th century. In the early 20th century, diabetologist Dr. Frederick Allen tried a new experiment of helping those with diabetes. He prescribed low-calorie diets as little as 400 calories per day for his patients. This diet prolonged the life of people with diabetes but kept them weak and suffering almost to starvation. Patients would pray for a cure for diabetes and hope that it would become a manageable disease. Finally, in 1921, a miracle occurred in Ontario, Canada. Surgeon Frederick Banting, Charles Best, and the help of Dr. Kolop and Dr. Masleoid administered a more refined extract of insulin to Leonard Thompson, a young boy dying of diabetes. Within 24 hours, Leonard's dangerously high blood glucose had dropped to near normal levels and the boy's life had been saved. Before the discovery of insulin, most children diagnosed with diabetes, like Leonard, were expected to live less than a year. With such an astonishing discovery, the news spread across the world and prolonged and eased the lives of people with diabetes. It was then, in 1921, that Banting, Best, Dr. Kolop, and Dr. Masleoid discovered that the pancreas produces insulin for the body. Banting and Best made getting insulin free of charge so that millions of diabetics worldwide could get access to it. Today, insulin can be taken in two different ways, either through an injection of a syringe or by a pump. Only type 1 diabetics are required to use an injection syringe or an insulin pump. An insulin pump is typically the size of a beeper and can be worn anywhere on the skin. Injections of insulin are taken by a syringe, or also known as a needle or shot. An insulin pump can improve blood glucose control and quality of life. Depending on what type of insulin you can take, it can last up for various hours depending on what type. Some can last up to 20 hours. Type 1 diabetes is when a person's pancreas produces little or no insulin. It occurs when the body's own immune system attacks and destroys the insulin-producing cells in the pancreas. People with type 1 must inject insulin several times every day or use a patch that pumps insulin into their skin. Type 1 can occur at any age, but most commonly occurs in the late 30s. Symptoms for type 1 include extreme thirst, frequent urination, drowsiness, sugar in urine, sudden vision changes, increased appetite, sudden weight loss, unconsciousness, heavy breathing, or fruity, sweet-like odor on breath. Type 1 diabetes is a chronic disease that cannot be grown out of or get rid of. Type 2 diabetes, the pancreas still produces insulin, but the body does not produce enough or is not able to use it effectively. Type 2 diabetes is the most common form of diabetes. Type 2 diabetes typically develops after age 40, but it has recently begun to appear more frequently in children. It usually occurs slowly over time. For instance, most people with the disease are overweight when becoming diagnosed. Increased fat makes it harder for the body to use insulin the correct way. Excess weight might increase the risk of premature death among people with type 2 diabetes. Symptoms include frequent urination, thirsty, increased appetite, sudden blurry vision, cut and bruises that heal slowly on the feet or the hands, tingling pain or numbness in the hands and feet. Although in the 21st century today, doctors have learned to make diabetes a treatable disease, diabetics have learned the proper ways of taking care of the body so it doesn't become an everyday setback. If a person has type 1 diabetes, the person is required to inject insulin with a syringe or have a patch on the skin that pumps insulin into their body. The person is also responsible for checking the blood sugar. If a person is type 2, it is a little easier to control and less complex than type 1. Type 2 diabetes can still produce some insulin in the body, but doctors require the diabetics to eat a well-based diet. The difference between type 1 and type 2 diabetes is that diabetics with type 1 diabetes are required to inject or take insulin in some way. Being diagnosed with diabetes and learning how to deal with it can be challenging, but diabetes can have long-term complications on the body as well. After many years of having diabetes, too much sugar in the blood can cause problems within the body. Many long-term complications could include eye problems, sores and infections on the feet or skin, which can lead to losing a leg, damaged nerves, trouble digesting food, kidney damage, or hardened time to control the blood pressure and cholesterol. All diabetics have increased chance for heart disease and stroke. Heart disease is the #1 cause of death in people with diabetes. Keeping the blood sugar, blood pressure, and cholesterol is a very important task for diabetics because it can help with the long-term complications. Every day, people are getting diagnosed with diabetes, whether a child or even an adult. Diabetes has become a manageable disease after many years of learning and studying about the disease. Diabetics have given the proper techniques and advice from doctors on how to take care of the disease. From only knowing so little about the disease to knowing that there are 2 types of the disease, scientists have once again shown to the world the ability of science.